Good morning everyone. Today we discuss about the sexually transmitted infection part 2, which involves only 4 MCQ. Keep attention. Question number 1. A 36-year female presented with a 36-year male presented with purulent urethral discharge, and the sample was collected on gram stain. The gram negative intracellular diplococci, which are kidney separate diplococci, are seen. Identify the causative agent. Here the topic is the purulent urethral discharge. The patient is having a symptom of purulent urethral discharge. This means that is the patient have urethritis. Patient have urethritis. The urethritis is caused by mainly, they are classified into gonococcal urethritis and non-gonococcal urethritis. Gonococcal urethritis means it is caused by the gonococcus. And the non-gonococcal urethritis is other than the gonococcus. That is maybe a bacterial cause, maybe a viral cause, maybe a fungal cause, or maybe a parasitic cause. In gonococcal urethritis, the causative agent is here is the gonococcus. Gonococcus is a non-capsulated organism which is a gram negative cocci. Generally they are the diplococci, which is the kidney separate. These are the gonococcus are the kidney separate. This gonococcus causes affects the male and female. In male, the gonorrhea or gonococcus causes acute urethritis, which is most common in male. And another one is the water can perineum. What do you mean by the water can perineum? This is an infection spread to periurethral tissue. The infection spread to periurethral tissue causing abscess and sinus formation. This is called the water can perineum. And the most common here is the acute urethritis, which is purulent discharge. In case of female, gonococcus causes mucopurulent cervicitis. And vulvovaginitis. They are the two main symptoms are due to the gonococcus, is called as the gonococcal urethritis. Okay. In the non-gonococcal urethritis, what are the bacterial causes of non-gonococcal urethritis? There are the chlamydia, trachomatis, ureaplasma, urealyticum, and there is a mycoplasma species. Okay, these are the non-gonococcal urethritis, that is the bacterial causes. What are the viral causes of the non-gonococcal? That is the herpes simplex virus. Okay, what are the fungal causes? And the fungal causes includes the Candida albicans. And another is the parasitic cause, which is caused by the Trichomonas vaginalis. These are the causative agents of the non-gonococcal urethritis. Then what are the difference of gonococcal urethritis and non-gonococcal urethritis? Okay, what is the difference of gonococcal urethritis and non-gonococcal urethritis? How we can differentiate it clinically? Gonococcal urethritis, the onset is less than 48 hours. less than 48 hours, and in the non-gonococcal urethritis the onset is more than 7 days. So symptoms appear more than 7 days. And in gonococcal urethritis there is purulent discharge, that is purulent urethral discharge, and here is the, that is mucus or mucopurulent discharge. Okay, coming to the question, that is a 36-year male, that is a male patient with present with purulent urethral discharge. Purulent, that is comes under the gonococcal urethritis. We conclude that the diagnosis is gonococcal urethritis. The sample was collected and the gram stain, they found that gram negative intracellular kidney sepate diplococci. They are all suggestive of the kidney sepate diplococci, non-gonococcal, gonococcal, and there is diplococci. Then the causative agent is gonococcus. The causative agent here is the gonococcus. The answer is the B, that is gonococcus. Coming to the next question, question number 7. Which of the following are the causative agent for non-gonococcal urethritis? In the previous question we already discussed about that, which are the non-gonococcal urethritis. Non-gonococcal urethritis, that is the bacterial causes, bacterial, fungal, and viral, and parasite. Discussed in the previous question. The bacteria, the Chlamydia trachomatis, Mycoplasma species, Ureaplasma ureaticum. In fungal, that is the Candida albicans. In the virus, that is the herpes simplex virus. In the parasite, that is the Trichomonas vaginalis. Here the answer is the all of the above. In the Chlamydia trachomatis, let's discuss further. That is, in Chlamydia trachomatis, only D to K causes the non-gonococcal urethritis, not A to C. A to C here causes the trachoma, and D to K causes the non-gonococcal urethritis. And this chlamydia is a obligate intracellular bacteria. Okay, and A to C causes trachoma. Trachoma in the eye. Okay, then let's classify the genitalia mycoplasma infection. Genital mycoplasma infection. They are classified into two types, that is the mycoplasma infection, and another is the ureaplasma. Under the mycoplasma there are two species. One is the Mycoplasma hominis and Mycoplasma genitalium. They are the most common causes of non-gonococcal urethritis in the mycoplasma, under the Mycoplasma genus. In the ureaplasma genus there are two species, that is Ureaplasma ureaticum and the Ureaplasma parvum. Okay, in the genital mycoplasma infection there are two types, that is the mycoplasma infection and the ureaplasma infection. Under the mycoplasma infection the causative agent are the Mycoplasma hominis and the Mycoplasma genitalium. Under the ureaplasma infection there is ureaticum and the parvum. Generally the Mycoplasma genitalium and the ureaplasma, all the species of ureaplasma causes urinary calculi or urinary stone formation. Okay, and the M. hominis generally causes pelvic inflammatory diseases. pelvic inflammatory disease and pyelonephritis. 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 Okay. Other than the non-gonococcal infection, all the ureaplasm and the mycoplasma genitalium causes the stone formation, and the mycoplasma hominis causes the pelvic inflammatory disease. And here the answer is the which of the following are the causative agent of non-gonococcal urethritis? The answer is the all of the above. Coming to the next question, which of the following is false about the Amsel's criteria for bacterial vaginosis? Bacterial vaginosis. What is bacterial vaginosis? Coming to that, bacterial vaginosis, the alternation in normal vaginal flora. Normal vaginal flora. There is change in or alter in the normal vaginal flora. In normal vaginal flora, there is increased concentration of lactobacillus, and there is decreased concentration of other pathogenic bacteria like Gardnerella vaginalis, Movinculus, and Mycoplasma hominis. All are the normal vaginal flora, that is increase in the lactobacillus and decrease in the vaginal, which causes there is decrease in pH of the vaginal flora, and that inhibit the pathogenic organism. In the bacterial vaginosis, what happened? There is alternation in the normal vaginal flora. Here, what are the altered? That is, the lactobacillus concentration is decreases, and there is increase of the pathogenic bacteria, pathogenic organisms like the Gardnerella vaginalis, Movinculus, and the Mycoplasma hominis. So, in the alternation, there is increase in the pathogenic organism causes the disease. These are called as the bacterial vaginosis. Why? They decrease in the lactobacillus concentration, which leads to increase in the pH of the normal vaginal flora, which provide a good environment for the pathogenic organism, which causes the bacterial vaginosis. Okay. Okay. Alternation in the normal vaginal flora leads to increase in the pH of the vaginal flora and leads to increase in the pathogenic organism. How we can determine the patient is suffering from bacterial vaginosis? There is a score which is called as Nugent score. This is very important for diagnosis of the bacterial vaginosis. How it can be done? The counting of the number of bacilli, the number of bacteria, that is the Gardnerella vaginalis, Movinculus, and lactobacillus. By counting the number of Gardnerella vaginalis, Movinculus, and lactobacillus present in the gram stain of the vaginal secretion, and the score, if the score more than 7, it is a diagnostic of bacterial vaginosis. Then how the score is predicted? By counting the number of bacilli, in the gram stain in the lactobacillus. For lactobacillus, if the number of bacilli per field, that is 30, more than 30, then the score is 0. the score is 0. If the count is 5 to 30, then the score is 1. If the count is 1 to 4, then the score is 2. If less than 1 or 0, the score is 3. That is, the more the number, less is the Nugent score for lactobacillus. In the other hand, for vaginalis, if the count is more than 30, the score is 4. 5 to 30, the score is 3, and 1 to 4, the score is 2. Similarly, for the mobilincus, if the count is more than 5, then the score is 2. If 1 to 4, then score is 1, and less than 1, that is 0. By adding all the lactobacillus per field, all the score for each individual bacteria, we finally found that the final Nugent score. If the Nugent score is more than 7, then we definitely call it as the bacterial vaginosis. Coming to the question, which of the following is false about the Amsel's criteria for bacterial vaginosis? This is the criteria defined for the bacterial vaginosis. Okay. There are two diagnostic tools. That is, one is the Amsel's criteria and the second is the Nugent score. We already discussed about the Nugent score. Now comes to the Amsel's criteria. Amsel's criteria, what it says, it has 4 parameters. What are they? White, homogeneous, thin vaginal discharge. It is the first criteria of the bacterial vaginosis. Then the pH of the vagina is less than 4.5. This is the first statement. Here the pH of the vagina is increases as there is decrease in the lactobacillus concentration. So the pH is more alkaline than the normal flora. That is more than the 4.5. This is the Amsel's criteria 2. The distinct fishy odor immediately after vaginal secretion are mixed with 10% KOH. This is called as the whiff test. By adding the 10% KOH, there is release of amines. Which causes the fishy odor. This is called as the whiff test, and it is under the criteria number 3. And there is presence of clue cell. What are the clue cells? These are the vaginal epithelial cells. Coated with the cocobacilli and which appears as a granular appearance. It is called as the clue cells. Okay, these are the criteria number 4. There are 4 criteria. Criteria 1 is there is white, homogeneous and the thin vaginal discharge, and the pH is altered, that is more than 4.5, and there is whiff test. The whiff test is positive due to production of amine which causes the fishy odor, and there is presence of clue cell. So the answer here is the question that is the false. The answer here is the pH of the vagina less than 4.5. Coming to the next question. A 30-year female presented with perivaginal pruritus, thick white discharge with pH less than 4.5. Mention the appropriate causative organism. Here there is perivaginal pruritus and there is white discharge, and the pH is normal. That is normal in the normal vaginal flora, that is less than 4.5, which is normal condition. Appropriate causative agent. Perivaginal pruritus means there may be infection in the vulvovaginitis. Infection may involve the vulvovaginitis, vulva and the vagina. These are the caused by three microorganisms. One is the Gardnerella vaginalis, another one is the Trichomonas vaginalis, and another one is the Candida albicans. Candida albicans. They are the three most important causative agent for the vulvovaginitis. How they are differentiated from each other? In the Gardnerella vaginalis, there is discharge, slight increase in discharge. In Trichomonas vaginalis, profuse, there is profuse discharge, and in the Candida albicans, the discharge is scanty. And in Candida albicans, there is itching. Itching is more prominent in Candida albicans, and the scanty discharge is a characteristic color, that is white, cheesy discharge. They are the features of Candida albicans. And here in the Gardnerella vaginalis, the discharge is slightly increasing discharge. They are the thin and homogeneous discharge. And the pH here is we already discussed, the pH here is the 4.5, more than 4.5. In Trichomonas vaginalis, the pH is also more than 4.5. But in fungal infection, that is Candida albicans, the pH is less than 4.5. The vulvovaginitis, the causative agents are the three, and they mainly affect the reproductive age group female. Okay, reproductive age group female. And other differences are in the Gardnerella vaginalis, we found that whip test is positive, which is also positive in the Trichomonas vaginalis, but it is negative in the Candida albicans. Okay, Candida albicans. We can see on microscopy, Gardnerella vaginalis microscopy, we see that is clue cells are present, and the diagnostic is Nugent score is more than 7. Okay, in Trichomonas vaginalis, we see in the microscopy, that is the Trichomonas vaginalis trophozoite form. Okay, and there is increase in the pus cell. In the Candida albicans, we see on microscopy, that is the budding yeast cell with pseudohyphae. Then coming to the question, a 30-year female, that is in the reproductive age group female, presented with perivaginal pruritus, that is itching, and thick white discharge with pH less than 4.5. Then the appropriate answer is the Candida albicans, which causes the vulvovaginitis. The answer here is the Candida albicans. Thank you.